All right, it's 3:05. Welcome, everyone. Thank you for joining us today. My name is Lamecca Holmes. I'm the director of the East Flatbush Community Partnership. And today you are with us for our monthly meeting, and it's July. Welcome, everyone. If you haven't already, please introduce yourself in the chat. We would love to know if you are a resident, if you're a service provider, and feel free to put your contact information in the chat as well. Up on the screen, you see our agenda for today. This is our welcome. We're going to provide some East Flatbush Community Partnership updates. And we have two presenters today. We have Jason Carey from New York State of Health, and we have Lisa Menon from Memorial Sloan Kettering Cancer Center. We're going to have our program updates where you all will get an opportunity to share about what's going on in your world, in your programs, any events, and then we'll have our closing remarks. So with that said, I am going to pass things over to, oh, actually, no, I want to share this and then I'll pass things over to Melissa. So this is the agenda for the rest of the year. Right now, we have our virtual only meeting for July. August will be virtual only as well. September and November hybrid, back to October for virtual, and then our end of year celebration will be in December, and that will be in person. We are really looking forward to this end of year celebration. So when we start putting out the information about that, I really encourage you, if you are able to, feel free to attend. We would love to celebrate the end of the year with you. Okay. So I'm going to pass things over to Melissa so she can provide the East Flatbush Community Partnership updates.
All right. Hello, everyone. So if you guys aren't signed up already, please you can scan the QR code just to see if you maybe not this week or the next time we have a meeting you want to be a presenter. You can actually fill out that information and send that to Sydney, right? So her email is there on the slide, which is readc@jccany.org. Also, if you guys have any events or flyers coming up in the community, you could also send them to Sydney as well, because we also have a newsletter. So we can post them in our newsletter and send them out to the residents so they know about your event and other things that you have going on, right? So please don't forget to fill out the attendance form. So this is how we keep track of who's in the meeting. So please don't forget to fill that out. Thank you. Mommy. So if you want more information about our organization, you can easily go to the website, which is eastflatbushpartnership.org. There you can find out more information about, what the organization does, events, the residents, any service providers, and also how you can volunteer or donate. So our general meeting, this is where you guys are, where the magic happens today, right? So our general meeting is basically every Thursday, every fourth Thursday of the month, and that is from 3 to 5 p.m., right? So we do a hybrid and virtual mix. So like Lamecca said, we're going to be virtual today and also next month, but then we're going to be a hybrid in September. So hopefully we can see you guys there. And virtual open door. So this is also another meeting that we have. It is virtual and it's every second Thursday of the month at 7 p.m. So we do different things, like we talk about resources, learning opportunities, community networking. So if you're interested, or anyone you know that you think may be interested, you can send them a copy of this flyer and they can scan the QR code to register for the meeting.
Thank you so much, Melissa. We're going to pass things over to Cindy, and Cindy is going to provide updates about our events we have going on next.
Okay, thank you, Lamecca. So one of the events that is coming up is August 7th, which is a Friday. This is a block party back to school resource fair. Taking the lead is the Family Enrichment Center, The Yard. So if you are interested in tabling at this event, the opportunity still is open. But we are supporting this event with sponsorships, and we look forward to doing it each year. And it's a really big festival event with the community. So we encourage you to come out, share your resources with the family, and let them know what is available in the community. And that will be it's going to be a block. So the block will be shut down. Sorry, Lamecca. So can you just go back quickly? Between Church Avenue and Linden Boulevard, but on Brooklyn Ave, starting on the Church Avenue and Brooklyn Ave corner side, just to make sure that was clear. Next. And then also supporting the Community Board 17 with their annual health and wellness community event at Farragut's Park. This will be August 15th from 10 a.m. to 4 p.m. I know that Ms. Bartlett, who's taking the lead on planning this event, is still looking for partners to table and share resources with the community. So if you're still interested in that, there's still open opportunities to table, again, to share resources with the community. If you have not done so yet, residents, service providers, please introduce yourself in the chat, just sharing your name, your email address, your affiliation, and so we can just make sure we're still all connected. Thank you, and know who you are. Thank you.
Thank you, Cindy. We're going to pass things over to Edlin now, and Edlin is going to introduce our first presenter.
All right, good afternoon, everyone. So we will be starting off with our first presenter for the day. His name is Jason Carey, Chief Marketing Officer for the New York State of Health. Jason?
Hello. Let me get my stuff set up here. Wait. Hold on one sec. All right, so can you all see my screen? Yeah. Good. Okay.
Yes.
And I'm just going to put on my headphones because my colleague's sitting right next to me and I can hear him. I can hear myself through his headphones. So, all right. So are we good on the talk? Okay, great. Well, thank you for having us today. My name is Jason Carey. I'm the Chief Marketing and Communications Officer for New York State of Health. Today, what I'm going to do is I'm going to walk you through an overview of what we are doing on implementing the HR1 legislation. HR1 is also known as the One Big Bill, One Big Beautiful Bill, signed into law last year, and there are many provisions within it that have affected New Yorkers already and will affect New Yorkers going into the new year regarding their coverage. So we want to make sure that everybody understands the overview of the legislation and the specific impacts within our space. So today I'm going to start off with an overview of the impact to the Essential Plan, and then I'll get into what is happening on the Medicaid side. We'll talk a little bit about our communications and marketing plans, and really for this audience, what is most critical is how partner organizations can help consumers navigate these changes. And we have been working hard on getting the tools ready for your use to distribute throughout the community. So that's an important part of what we want and need our community partners and stakeholders to do. So first, let me start with the Essential Plan. So the Essential Plan opened under the Affordable Care Act as the basic health program, with which limited income to adults 1964 to 200% of the federal poverty level. We were able to expand that population and raise the levels through our Section 1332 waiver, which raised the FPL to 250%, allowing another 450,000 people to enroll. Savings about $6,000 per year for comprehensive coverage as compared to qualified health plans. We then were able to offer cost-sharing subsidies to our QHP customers. And under the waiver, some of you might have heard we were actually able to do some innovative programs, one of which was in our second year this year, which was our Essential Plan cooling program, where we offered free air conditioner install for Essential Plan enrollees with certain health conditions. So as a program, it has been very successful in covering folks and also finding new ways to tie in the social determinants of health into our plans. So what essentially happened with HR 1 legislation is that it basically cut our budget in half. HR 1 limited the eligibility for premium tax credits, which was the main funding source for the Essential Plan. And so with that change, the funding was essentially cut in half, making the program unsustainable from a financial standpoint. From there, we decided to return to the basic health program. So essentially eliminating that expanded audience and the coverage for Essential Plan enrollees ended effective July 1 of this year. So what does that mean in this transition? It means that the original 1.3 million consumers in the basic health program with income up to 200 FPL will see no change. But it's that 450,000 consumers with income 200 up to 250 FPL who have essentially lost their coverage. Whoops, sorry about that. There were some other provisions for pregnant individuals as well as DACA. But essentially, what HR 1 did is cut a substantial number of people off of coverage. What we have done since April is trying to make sure that consumers understand what's going on. We started sending notices in April 1st. We followed that up in May with renewal notices. We opened a special enrollment period for transitioning members and allowed the enrollment for those folks to go through August 30th, 2026, with a retroactive July 1 start date. So we've really tried to smooth the transition, and it has been bumpy. It has been very fast, but we do see consumers coming back into the marketplace, and I can share a little bit of data on that. As of the 20th, about 50% of that 450,000 effective have come back into the marketplace in a QHP plan. Most people are opting for bronze and silver. We do see some folks in some of the other categories, but I think the good news is that people are coming back, and we are trying to figure out, how to smooth this and how to find the right plans for the right people. One of the things that has been important throughout this whole process is the wraparound support for New Yorkers, which includes our enrollment assisters, our customer service centers, direct communication with consumers, our New York State of Health Stay Connected webpage, and we'll provide all of these links at the end, as well as fact sheets on free or low-cost healthcare resources, as well as our continuity of care protections for folks moving into other coverage. I would say also, one of the big supports is the organizations that we work with, organizations such as yourself that are in the community and can really help folks navigate, which is why, we know it's important for these sorts of meetings to happen as frequently as we can, given all of the changes that are happening in the marketplace. So I'm going to pause here because I'm having a weird computer thing. Just give me. All right, sorry about that. We're back in action. Are there any questions that I can take on the essential plan information?
Yeah, if you don't mind, how you doing, Mr. Carey? Tyrone McDonald from Neighborhood Housing Services of Brooklyn. I know time is limited, and so you had to go through things, quickly. But what was the difference between the basic plan and the plan you had before, which was actually cut? What were some of the differences? Could you go over that?
Pretty much same coverage benefits.
Okay.
The difference was we were able to expand the income level to allow
Okay.
more people in. Yeah,
Okay. Thank you.
sure. All right, so let me jump into the Medicaid update, which is a little bit more complicated with all of the provisions that occurred under HR 1. So the main policy changes the big policy changes within HR 1 that were outlined were checks and restrictions on eligibility and enrollment, overall reductions in federal funding, and changes to our financing mechanisms. A lot of these provisions are what I would say behind the scenes, and affect, how the program works. But what is very much front and forward for us and for consumers is the implementation of work and community engagement requirements. So what does that mean? The law said that consumers who are in Medicaid, members who are in Medicaid, will now have to fulfill certain requirements to keep their coverage. That could be earning a household income of at least $580 with changes for seasonal workers, completing 80 hours of approved activities. That could be work, traditional or self-employed, participation in community service, enrolled in an education program or a work or job training program, or some combination of these activities. So one of the main things that we have been working on is how to figure out how to implement this rule and also figure out the people who it will affect. To that end, there are several exemption categories. So if you were to fall in one of these categories, you would be exempt from work requirements. However, there are other parts of the law that could affect you, such as twice a year renewals or other eligibility provisions that are built into the law. But for this conversation, we're really focused on the work requirements piece. What we've decided, and a lot of this is just following the letter of the law, we will enact work requirements beginning January 1st. We're only going to verify compliance or exemption at renewal. We're not going to do anything more frequently than is required. One of that is to just kind of smooth members into these new rules. A lot of this will be confusing for a lot of people, so we don't want to burden them with more administrative burden that is necessary. As I mentioned, we will be implementing twice a year renewals. So we will transition those members to their 6-month time period after their first renewal. And so everybody kind of comes in on according to their renewal timeframe. In terms of the community engagement work requirements, we'll need to make sure that folks are doing that 1 month before they are up for renewal. So that means that people will need to be engaged and completing those activities. And additional implementation decisions are under review. So it is a lot, and it is a lot for folks to understand. I think one of the silver linings is that most people are working and will be able to show their income. We are still working on figuring out how to use data sources for our student populations, and we're also focusing on what is called ex parte renewals, which is automatic renewals, and that's based on data sources so that a Medicaid member would come into the system, consent to us using data sources to verify their income, and that means that their coverage would renew automatically. And that's one of the big messages that we are going to be working on when we start really communicating the details around work requirements. We want to make this as simple and seamless as possible for folks so they don't lose coverage. And we are working on that within the New York State of Health application and making sure that that technology will be able to accommodate what we need for impacted members. So briefly, that just ties into how we have been planning and getting into the execution of our marketing and communications campaigns, really looking at this in stages, getting ourselves aware, getting our partners aware, preparing, developing materials, making sure that our website is updated, and preparing our partners, and then going into where we are now, starting to support impacted members through, text messages, letting them know that things are coming, and really making sure that they feel that we are there for them and have the resources they need. To that end, we will be launching our materials and campaigns under the Stay Covered branding. We are really focused on making sure that we're bolstering member trust, not only through our voice, but through other trusted voices in the community. We really want to allay any fears that Medicaid members have about these policy changes. We have a fantastic assister network who will be there. We're already training them to make sure that they can handle the influx of people with questions. We want to make sure that we're providing clear and timely information, and then leverage our stakeholders to amplify our message. So in terms of timing, what that looks like is we are starting to gear up now. Next week, we'll start to launch on our social media platforms, and we will make materials available on our website. And then as we move throughout the year, we'll leverage our existing outreach efforts, events, briefings like this with our partners to make sure that we're sharing information, and then also using these opportunities to talk to partners about what they can do for their constituents. And we are going to be developing a guide, a very specific guide for partners to use to navigate all of the things that are available, that will be available on the website for use. That means that we're all talking from the same place. We want to make sure that our message is amplified through all of the touch points, both, digital and people. And that means that we're spending a lot of time, working with partners to create these links, create these messaging opportunities, and then creating centralized resources to make sure everything is aligned. These are examples of some of the materials that will be available. We'll also be leveraging our social media platform and any other of our owned platforms, such as our e-newsletter. And we will leave you with these slides, which also contain important links that you can start to access now. One thing that we are really encouraging partners to do is to sign up for our e-newsletter, because that's where we'll be distributing information and updates on HR1 on a monthly basis. And with that, we want to thank you for the time, and we can take some questions.
Thanks, Jason. Does anyone have any questions?
Yeah, I have a question if no one else does, because I don't want to monopolize the time. Jason, all right. Question is, if I understand you correctly, so once someone's coming up for renewal, I guess the month um the month prior
The
to
month
renewal,
prior.
they are expected to have like at least 80 hours of community service. Is that
Yeah,
if I understand it correctly?
yeah, they would have to show that they are in compliance with the work requirements a month before they're up for renewal. So we message to members when things are happening.
Uh-huh.
And so the folks who will be impacted by work requirements, they'll know that they have to fulfill work requirements. So we're still working through identifying those people. But we will message them and say, hey, you are going to have to meet work requirements. Here's how you do it. And then as they come up for renewal, they'll have to demonstrate that they are in compliance.
Okay. And
Yeah.
secondly, are there any waivers given to individuals who are in college? Let's say, for example, and they're on Medicaid, are there any waivers for that?
Yeah, so the work requirements make provisions for folks who are in school at least part-time, and that's an exemption category. We are still working through the number of students in this the student population who may or may not be affected by this. Just as a data point, within the CUNY population, the CUNY student population, about 40% of those students are on Medicaid. So that's a substantial number of students. And so we're trying to figure out, how do we talk to those folks? Even if they are exempt because they are in school, they still need to know, what these changes are going to look like, so that, they can keep their coverage.
Well, thank you very much.
You're welcome.
Any other questions for Jason?
I do have one. Thank you, Jason, for what you shared so far. And I've been keep listening to this presentation just to make sure I'm informed. But are there any suggestions of unusual ways to inform the community? And I ask that to say because you are putting out as much information as possible. We're seeing other people try to make sure that families are informed. But we experience time and time and again where a big change happens, and so many people still don't hear about it until it's too late or emergency happens. So how can there's any unusual way to avoid that?
I think that's a great question. And, we know people don't pay attention until the very last minute. So I think what we're trying to do with all of our partners and with everybody is to get this information out early and as repetitively as possible. I think even though there are going to be specific changes for specific populations, I think the key is to make sure that we're talking to as many people as possible so everybody, can be aware that something is happening. Something is changing. I'm sure we all know somebody who is on Medicaid, right? And if I know that something's changing, word of mouth is is very powerful. But it's just going to take, I think, the volume of communications and repetitiveness to get people to really listen. Fortunately, as I mentioned, we have an assister network, and that's statewide, with folks who are trained to help people. Just as another data point, about 80% of Medicaid members enroll through an assister. So for those members who are who may be facing work requirements, the most important call is for them to get on the phone with their assister and say, "Hey, what's happening? What do I do?" So we're really pushing members to that. And then, through our outreach and our own platforms, trying to get to the entire community, but in particular, some of those hard to reach populations.
I have a question. Do you utilize text messages in your communication to members?
We do, yeah, and it's actually one of the most effective ways for us to message our members. One thing, we have several text messages going out over the course of this campaign, and folks respond to it. And if somebody has signed up through the marketplace and they haven't signed up for text messages, they can call our customer service center and ask to be signed up.
Great. And then how much coordination is happening between actual service providers for them to assist with this process too?
We are working on that piece. A lot of what I presented today is what we know as of today. There's more information coming. One of the things that we don't have yet are specific definitions around medical frailty and how that will be addressed. And we also don't have the specifics around the population that will be impacted by work requirements. So as soon as that's the biggest piece that people want to know about, and it's the piece that we don't have. So as we move through this year, we're going to be doing what we can from an outreach standpoint to prepare providers and plans. That's a mouthful. Prepare providers and plans with as much information as we can and get them, teed up. So when that information comes through, that everybody is kind of ready to go.
Thank you. And one last follow-up question. Would you say the people you mentioned, people that you guys are training for when people call in, Would you say that that's the most reliable source for a resident? Okay.
Absolutely.
The reason why
Yeah,
I ask is
absolutely.
sometimes, we call state entities and it's like you just get bounced around and it just rings. So I just want to make sure we can direct them there and they'll get help.
Yep. The assisters, they can, a member can go on our website, find a local assister. They can call our call center. We know call volumes are high, but I will put in a plug for our callback feature. And that's the best place to start. And I think for our community-based organizations and other stakeholders, the best thing to do is to have that correct information. So rather than you're not going to solve their enrollment issue,
Right.
but what you can do is you can be the best traffic operator, traffic control, and point people
Yeah.
in the right direction.
I'm so glad you said that because I think sometimes in efforts to help, we can make things more messy. So that was great. Thank you. Any other questions for Jason?
Yeah, we will. What we want to do, once we have everything up on the website, we will notify you guys through this group so you can then disseminate out. And we'll share these slides, and the links in our slides are live, so you can start to look on our website and find stuff. Oh, and that's another thing that I wanted to mention. We have materials available in 26 languages. So that is important, particularly for where you guys are. What's your physical address?
57 Willoughby Street. It's actually not in East Flatbush.
Okay.
It's downtown Brooklyn. Mm-hmm.
Okay. Yeah. So I worked at Brooklyn College, so I can kind of know a little bit about that area.
Yeah,
So.
we used to be really close to Brooklyn College.
Yeah. Okay.
Thank you so much, Jason. This was very
Thank you.
informative.
Sorry, Jason, I'm not sure if this is something that we should be concerned about, but do you expect, I know we want to make sure that people remain in care in general, but are there any certain services of care that may be affected by the changes more than others?
That's a good question, and let me take that back. I don't think that the particular services would be affected. It's more of keeping your total coverage rather than it, taking a particular benefit away. But we can take that back and get some clarification on that.
Thank you.
You're welcome.
Thank you. All right, I'm going to share my screen
right.
again and we'll have,
Thanks, everyone.
thank you, Jason, and we'll have Edlin introduce our next speaker.
Yes, and before we go ahead and do that, I would like, if everyone didn't get a chance to, on the chat, we put in our monthly attendance link. So if you have a chance, just fill out our monthly attendance link form as we capture, everyone that's in attendance. So please, while LaMecca put the slide up, if you have a little bit of time to just go on the chat, click the link, and just fill out our form. Thank you. Okay, so while we go ahead and do that, let's go ahead and present our next presenter, Lisa Menon. Hopefully I'm pronouncing your name correctly. She is a project manager for the Immigrant Health and Cancer Disparities Service, Memorial Sloan Kettering Cancer Center. All right, so the floor is yours.
Well, thank you. Let me just share my screen for a second. Can you all see this?
Yes.
Okay. All right, perfect.
Yeah.
All right. So thank you, first of all, for having me. So today I am going to be talking about lung cancer screening. So just to give a bit of background, as Eileen mentioned, I am a project manager at the Immigrant Health and Cancer Disparity Service. And so a lot of what we kind of focus on is addressing health disparities, not only among immigrant communities, but also minority communities, medically underserved communities, low-income folks, And so this is kind of the presentation that we have been giving to a lot of community groups, and I'll kind of explain a little bit about the importance and the background of that as well. So we have recently, as a service, had a goal to expand access to lung cancer screening and smoking cessation. And so I have been overseeing a lot of these efforts and have been targeting a lot of the outreach based on some areas that were identified by heat maps that we created when we initially started these efforts back in April of last year. So those heat maps basically focused on neighborhoods with high smoking rates and high lung cancer incidence rates. And then based off of that, we've been partnering with a lot of community-based organizations, churches, faith-based groups such as mosques, and then also a lot of the NYCHA facilities, which I'll get into a little bit later. But basically, when we do encounter eligible community members that have accepted insurance, we do refer them directly into MSK, either through the Ralph Lauren Center at Harlem, through any of our Manhattan sites, including the Koch Center for Cancer Care. And then one thing that we're really actually excited about is that the Memorial Medical Care PC Practice of MSK Physicians Center will be opening up soon for lung cancer screenings. So our hope is that once we encounter community members in Flatbush and nearby areas, we can refer them directly to this service, but still have a lot of MSK radiologists read it and have a lot of the navigation and care that our team provides as well. Also, for community members who wanted to stay close to home or don't have insurance, we do refer them to a lot of other facilities that we've built up partnerships with. And a lot of the facilities are H&H public hospitals. So it's a really great place to have, a broad range of care. And so we also refer community members and existing MSK patients who are interested but may not qualify for lung screening to smoking cessation if they would like to try quitting. So some basics at first. So what is screening? It's basically very simple in terms of checking for disease. So screening looks for diseases before a person has symptoms. And usually the earliest that people find these diseases or, any of these sorts of like nodules in terms of lung cancer, that is when it is easier to treat and to cure. So what happens during a screening? It's basically a low dose CT scan. And so that's a special kind of X-ray that takes pictures of your lungs and your chest area. And the scan only lasts a few minutes. And it's not painful. Basically, you can kind of see a picture over there. I'll have another diagram a little bit later, but basically it's this open donut-shaped machine that you kind of just go through. And it basically is only 5 minutes. So it's really a quick and easy procedure. So what is lung cancer? It's basically a disease where abnormal cells grow in the lungs and form tumors. And these tumors can damage the lungs and spread to other parts of the body. So why lung cancer is so important is because it's the leading cause of cancer death in the US. And cigarette smoking is the leading cause of lung cancer. However, there are other risk factors such as secondhand smoke, radon, and air pollution. And so lung cancer accounts for about 1 in 5 of all cancer deaths. So for most cases in early stage lung cancers, there's not really any symptoms or signs. So that's why screening is so important, because it may be the only way to catch them. If you do have any of the signs that are mentioned on the slide, it is very strongly encouraged to speak to your doctor so that they can figure out the best test for you. So that can include a cough that doesn't go away or worsens, shortness of breath, coughing up any sort of blood or like rust-colored dark mucus, feelings of being very tired or weak, a loss of appetite, or an unexplained weight loss. So as I mentioned, tobacco is the #1 risk factor for lung cancer. So tobacco smoking is the leading cause of preventable death and disease, primarily because it contains many harmful cancer-causing chemicals called carcinogens. And it also has nicotine, which I'm sure everyone is very familiar with in terms of how addictive it is. So just a couple of really quick stats. For lung cancer in Black Americans have historically had higher rates of lung cancer compared to other groups and are more likely to get lung cancer at a younger stage or get diagnosed at a later stage when the disease is more advanced. And tobacco companies historically have also targeted a lot of Black communities, especially at younger ages, with cigarette advertising. So just some screening stats, about 9 out of 10 or 90% of lung cancers that are found on screening are early stage. And so that kind of emphasizes the importance of why these screenings are so important, because up to 90% again, so 9 out of 10 people with that early stage lung cancer are usually cured after treatment with surgery or radiation. So in a lot of these cases, chemo is not really necessary if they find something that is suspicious and ends up being cancerous if it's early stage. So yeah, I mean, basically reiterating, lung screening is the best way of finding lung nodules, even though that's not always cancer. So some nodules are just kind of like an early stage of cancer, and some nodules are completely harmless. But basically, because early stage lung cancers don't have symptoms, screening is the best way to catch them. So this is where things get a little bit complicated. There's 3 different screening criteria that are very oftenly used in the United States. So the first one is the United States Preventive Services Task Force criteria. This is what's most commonly used. And so that indicates that you have to be 50 to 80 years of age, smoke cigarettes now or quit in the past 15 years. And then this is honestly the hardest thing to match because a lot of folks don't know how much they have smoked over the course of years. But basically, you would have had to have smoked an average of a pack a day for 20 years. So it's basically like this thing called 20 pack years, and any equivalent of that is fine. So if you smoked half a pack a day for 40 years, or you smoked 2 packs a day for 10 years, or you did a pack a day for 20 years, all of these count. And then in terms of the other criteria, American Cancer Society criteria is what MSK uses. So you would have to be 50 to 80 years of age again, smoking an average of 20 pack years. But the key thing here is that you don't have to have quit, within the past 15 years. So you could have quit 20 years ago, 25 years ago. If you're eligible with everything else, you are still eligible for lung screening. And then lastly, is the Centers for Medicare and Medicaid Services criteria. That's a little bit different in terms of age. So it's only 50 to 77 years old. Again, 20 pack years, and then smoke cigarettes now or quit in the past 15 years. So in terms of where you can get screened, the USPSTF, so that's the first criteria that I mentioned, that is accepted at Jamaica Hospital, Flushing Hospital, and any New York City Health and Hospital site that does lung cancer screening. So one that's really popular with a lot of the patients that we encounter, or a lot of the community members that we encounter at Flatbush, is the Kings County Hospital site as well. And in all of these, services are provided regardless of immigration status. Criteria 2, as I mentioned, was Memorial Sloan Kettering and the Ralph Lauren Center, which is up in Harlem. And pretty soon, once the location in Flatbush starts screening patients, that will also fall under that criteria. And then the last one for Medicaid and Medicare, Montefiore and SUNY Downstate are both options there. So if you're interested in getting screened or would like to be connected to these resources, you could feel free to reach out to me. I dropped my email in the chat before, and I can also upload a flyer a little bit later as well. So once you do get screened, you should be getting screened on a yearly basis, once a year, unless you're told otherwise. And again, this is a bigger picture of the low dose CT machine. Again, like a donut shape, and you just kind of roll through there for about 5 minutes. And then this is a very common question that we get in terms of how much does lung screening cost? So the fact is that Medicaid, Medicare, and most other health insurance plans will actually cover your screening if you're eligible. And so if you meet that criteria that I talked about before, that's the key thing. And if you have any questions about whether your insurance covers that, again, feel free to reach out to me, and my team would be happy to help kind of navigate you through those resources. And then we can also help you find free options if you don't have insurance, if you're worried about your immigration status, because we see a lot of folks that are undocumented, or if your insurance for some reason does not cover screening. So here again are some just free, low-cost lung cancer screening resources. Jamaica and Flushing and the New York City Health and Hospitals sites that I mentioned, as well as some nationwide resources. So the National Cancer Institute Cancer Information Service, the American Cancer Society, and the GoTo Foundation for Lung Cancer. So a lot of what we encounter out in the community is an idea kind of related to fear, stigma, and all of the other things that are sort of associated with lung screening. So many people are afraid or anxious thinking about lung screening. A lot of folks don't want to talk about it. A lot of people don't want to talk about smoking, and then other folks don't want to talk about cancer in general. And a lot of people don't also want to be lectured or nagged about quitting. Some people who do end up getting a diagnosis also say that they feel guilty about ever starting to smoke. So these are feelings that are very understandable. And we know that they can make it hard to take charge of your own health. So again, this is a very free, judgment-free zone in terms of, my team and kind of what we have been trying to do to navigate folks to resources. So please feel free to ask any questions, and we'll definitely be able to talk about your concerns. So this is something we just kind of like to show in any of our presentations. Your healthcare rights and everyone's healthcare rights in New York. Everybody, all patients have rights regardless of national origin, insurance status, and source of income. Confidentiality is something that everybody should be aware of, especially the fact that the conversations with your doctor are confidential and private, as well as your medical records. And then we also encounter a lot of people who are limited English proficient. And so all of those people also have rights to interpreters so that they can get healthcare in the language that they need. So just to go through some risks and benefits of screening. For the benefits, obviously, we've already kind of talked about this. Early stage cancer can be found early when it's treatable. And the biggest thing is that it can save your life. We do also talk about risks, though. There is a tiny amount of radiation from the low-dose CT scan, though it's typically about a quarter of an actual CT scan, or like just a regular one that is done diagnostically. There is a risk that we could find things that look like cancer but are not, so like a false positive. They can also find things that may have never caused a problem. And so that, is something that's called overdiagnosis, and that can lead to treatment that is not necessarily needed. And then one thing that a lot of people have mentioned to us is that they're typically very anxious and fearful about waiting for the results. That's a very normal feeling to have. But ultimately, I think the fact that it can save your life does outweigh the risks. And then just some general tips to keep your lungs healthy. So obviously the biggest one is don't smoke. That's the primary thing. Avoid breathing indoor and outdoor pollutants. This is obviously very much easier said than done, especially over the last week with all the wildfire smokes and everything else that's been happening. And we're living in New York City, so obviously there's a lot of, pollutants that are kind of happening and around us at all times. But I guess just as much as possible, and if you encounter a situation where there's a lot more, smoke or something than usual, wearing a mask sometimes helps. And then moving, exercise strengthens the lungs. Getting your annual physical is extremely important because then you've built up a relationship with your primary care provider, and they'll be able to kind of identify if, something is a little bit suspicious or concerning in terms of lung cancer or any other condition. And then wash your hands often. This is something that, I think kind of gets overlooked as well, but trying to prevent respiratory infections as much as possible can ultimately help your overall lung health. And then some health benefits of stopping smoking It improves your health and increases life expectancy. It lowers the risk of 12 types of cancer and cardiovascular disease, and it lowers the risk of chronic obstructive pulmonary disease, COPD. It also benefits people who have already been diagnosed with coronary heart disease or COPD, and it benefits people at any age. So even if you've smoked for years or have smoked heavily, quitting will still help. And there's actually like a stat that we typically kind of mention at a lot of these community presentations, which is that after you've stopped smoking, let's say you've quit for about 15 minutes, your lungs already start to feel a little bit better and also start to get a little bit healthier. So a span of 15 minutes can actually make a huge difference. I mean, obviously, if you keep that up. So it's a lot of positive impact for quitting smoking. So how to quit and stay quit. Again, it's very challenging because the body can become addicted to nicotine. Also, a lot of times smoking is tied in with a lot of other habits in your life. Like sometimes, you could go driving and you're used to having a cigarette. If you're doing some social drinking, you might want to have a cigarette. So it's very tied into a lot of different things and stress, of course. However, there are safe and effective treatments to help you stop smoking. So there is counseling where you can kind of work with someone to make a plan to stop smoking and manage your stress and urges to smoke. There's also medications, so that will help manage nicotine withdrawal symptoms and cravings. And then usually the strongest method to do this is a combination of both. So using them together increases the chances of successfully stopping and staying quit. So what about vaping, e-cigarettes, electronic nicotine delivery systems, or any other forms of tobacco? A lot of people, kind of rely on vaping to help them quit smoking, but there's no strong evidence that says that vaping does that. There are, however, safe and effective behavioral strategies and medications available for quitting smoking. So to help with quitting smoking, we do recommend use of approved medications that don't introduce, another sort of dangerous chemical substance into your lungs, especially because now there's like a lot of things called modified risk tobacco products. So I think if you're trying to, use one of those, I would definitely be aware of any sort of like safety claims and speak with your doctor if you're trying to, start on that regimen. So in terms of, okay, let's say you want to stop smoking, what do you do? There are a lot of resources that can help. We do have a tobacco treatment program at Memorial Sloan Kettering. It's a really great program where they do actually offer that combination of therapy as well as, NRT or nicotine reducement therapies as well. There is also other options in terms of the New York City Health and Hospital sites, Jamaica Hospital, and then one of the best resources is the New York State Smokers Quit Line. So they offer a lot of medications free of charge if you call them. So they're a really great resource, pretty easy to use. They have resources in other languages. So I would definitely recommend using that if you or someone that you know is interested in stopping smoking. And then I just wanted to kind of show some outreach activity highlights, what we've been doing since the plan that I mentioned at the beginning of this presentation. So we have been building a lot of partnerships and lung screening referral pipelines with healthcare facilities in New York City. So aside from MSK, we want to make sure that there's, a lot of resources for folks that are closer to home or for people that have insurance that MSK might not take. And so these sites are really great resources that we've worked very closely with to be able to refer people who are eligible for lung cancer screening. We've also synergized a lot of efforts within MSK. So we present monthly, and basically that's kind of co-hosted by the co-director of the lung cancer program at MSK. And so we've kind of worked to present all of our outreach updates at those meetings. And then we've also streamlined a lot of workflows with our patient access service. Basically, that's the group that will schedule you initially for lung cancer screening. So we've kind of worked to, kind of reduce as much time as possible and make it more convenient for people to attend these screening appointments at MSK, and also have the immediately preceding appointment with a nurse practitioner to kind of go over shared decision making and what lung screening is all about. We've also reinforced a lot of our knowledge and engagement about lung screening among our outreach team. So we have people that go out all through the city, through our mobile health unit, through our taxi network, which works a lot with taxi and livery drivers. We have another program that's focused on community outreach in partnership with the City College of New York. So there's a lot of different outreach events going on at any point during the week. And so we've really kind of tried to reinforce how to best educate community members and also address a lot of stigma and barriers that come at each point that we're at. We've also identified a lot of community-based organizations and events, as I mentioned, in the heat map focused areas. So we've been working a lot with faith-based organizations and churches. And then we also have a huge focus on NYCHA developments. So the picture on the right at the bottom is actually a workshop that we did recently with the Wagner houses up in Harlem. And so they have been great and they've been really receptive. We've also worked with the Lexington houses, Johnson houses, Morrisania houses, and also the Walt Whitman houses in Brooklyn. And then we've also kind of designed all of our presentations, workshops, and materials to be very linguistically and culturally tailored. So as I mentioned, we have a lot of folks who are limited English proficient or from all different walks of life and cultures. So we make sure that whatever we're presenting to them and whatever we're sharing with them could be very easily digestible by them as well, and very easily comprehensible and understood. And then lastly, we have focused on the patient perspective during a lot of the outreach and education. So I mentioned the materials, but we've also actively worked to reduce the barriers, including cultural stigma, medical mistrust, and interpretation concerns. And I think the key takeaway here is that we are here to help. So you could definitely use the QR code to get connected. But in addition to lung cancer screening, we also navigate to other cancer screenings. So breast, colorectal, prostate, and cervical. We also help assist community members find a primary care provider if they need one. And then we'll also help enroll them into insurance if they're uninsured. And then we provide a lot of health education. So in addition to lung cancer screening, we also offer a lot of workshops focused on healthy living for cancer prevention. And we do a lot of health fairs throughout the city with our mobile health unit, and then just through outreach and tabling. So there's a lot that's been going on. And as I mentioned, since we are, kind of branching out into Flatbush more, and I expect we will be in the coming months, I'd love to kind of hear if there's any folks that are interested, or if they know of anyone, please feel free to refer them to me and be happy to get them connected. So thank you.
Thank you, Lisa. Does anyone have any questions? Tyrone, go ahead.
Yeah, how you doing? Thank you, Lisa. Now, with your program, you said that it actually was Memorial Sloan Kettering.
Yeah.
In order to benefit, I'm assuming the screenings are free, right?
Yeah.
Correct me if I'm wrong. Is this exclusive to certain areas, which are high risk?
No. So we've just been targeting a lot of our outreach to the high risk areas, but this is
Okay.
literally anywhere in New York City and
Okay.
Long Island. We just started to branch out to Long Island. Yeah.
Okay. All right.
Yeah.
Thank you.
Yep.
Any other questions? Okay, Lisa, thank you so much. That
Yeah,
was
thank
very
you.
informative.
Thank you so
Thank
much. I'll
you.
drop the flyer into the chat as well. So thank you, everyone.
Great. Thank you so much. Okay, now we're going to open up for anyone who wants to share program updates. This is where you can share about any events that you have going on. If you want to share your screen, just let me know. I can make you a co-host. So would anyone like to begin with our program updates from you all? Tyrone?
Yes, how you doing? Yeah, would you mind allowing me to get a co-host privilege so I can share my screen?
Mm-hmm. Yes. Okay, you're good.
Okay, great. All right, so let me just share. Let's look for my event. Okay. Pardon me. Good day. Um, I'm sorry. This is the wrong flyer. I apologize. Let me stop the share here. This is
It's
what
okay.
happens when I have, like so many things open.
It's
So,
okay.
all right, there it is. All right, on July the 30th, Thursday, 6 p.m. This is an in-person event. This is going to be held at Lenox Road Baptist Church. We're actually having a Money Moves event where we're going to talk about banking. Just talk about the ins and outs of banking and try to demystify certain things. We're going to talk about credit and includes credit scores, um, maintaining good credit, what goes into a credit score, and briefly on homeownership preparation. That's going to be on Thursday, July 30th at 6 p.m. From 6 p.m. to 8 p.m. at Atlantic Shore Baptist Church, which is at 1354 Nostrand Avenue. That's actually at the corner of Nostrand and Atlantic Road. All right. So I'm going to stop this share. I just have like two other events, which I'm going to get into. All right. We're having a clean energy home resource event. This is not in person. This is via Zoom. It's going to be on 6 p.m. to 8 p.m. We're just going to talk about energy efficiency tips, programs, actually, if you want to do upgrades, whether it's credits, whether it's grants, um, and so forth. We are also going to talk about free energy assessment tests as well. So that's going to be on Wednesday, July 29th at 6 p.m. You can also go to our website at nhsbrooklyn.org, and also we'll post these flyers in the chat. And lastly, let me go to the next one. It's going to be our first time home buying workshop. So we're going to have our monthly home buying workshop. This is going to be in the afternoon. We give it twice a month, one in the evening, once in the afternoon. This is going to be on Tuesday, July the 28th from 12 p.m. to 2 p.m. Take advantage during your lunch hour. And I will post this all on the chat. All right. Thank you very much for your time, everyone. And hopefully you'll be able to take advantage of some of these workshops.
Thank you, Tyrone. Selena, I see your hand up.
Hey everyone. Thank you so much, Lameka, for hosting this space for us to share our resources and great presentations today as well. My name is Selena. For those of you who don't know me, I'm from NYPCC, which stands for New York Psychotherapy and Counseling Center. And right now we have immediate openings, both in person and virtually. So I'll be sharing the flyer in the chat box. Please feel free to reach out if you have any questions. We also provide mental health awareness workshops for parents. And we look forward to working with you in the new school year. Thank you so much.
Thank you.
Question, you have no wait list at this moment?
No wait list at this moment.
Okay, thank you.
We usually typically don't have a wait list, but right now we have immediate openings.
No, I know some people are experiencing even 2 months of a wait list.
Mm-hmm. So you'll be
thank
happy
you.
to know that NYPCC does not have a wait list, and we are very flexible with our hours of operation. Monday through Friday, we're open from 9 a.m. to 8 p.m. The weekends from 8 a.m. to 6 p.m. and virtually up until 10 p.m. So just very flexible with our hours of operation.
And no limitations on the kind of care they need, like schizophrenia?
Yeah, we service a various amount of needs for mental health services. So it can be something as, like just wanting to talk up to someone. Maybe your kids are stressing you out, your husband, right? And more severe diagnoses like schizophrenia, bipolar disorder, and so on and so forth. Thank you so much for that question, Cindy. I'm gonna share the flyer in the chat box and my contact information. Thank you, everyone.
Thank you, Selena. Jacqueline, you can go next.
Hi, good afternoon. How's everybody doing? Okay, your hair looks
Great.
lovely. I'm still in my feelings about last month meetings, but that's okay.
We
Wanted
understand.
to talk about Hope Center Development Corporation. Every year we have our community expo. So this year will be on Sunday, August 9th. Last year we had over 1,000 people attend. It was the biggest event ever, and we had over 50 vendors. So this year we're planning to, create the same kind of energy. Those that are interested, I have put the vendor flyer and the link in the chat. But all those who are interested in highlighting their program in the community for East Flatbush and Brownsville, we greatly appreciate it. And that's pretty much it.
Thank you.
And if anybody has any upcoming events in the next few weeks, to email me so that we can also participate in your events as well.
Thank you. Anyone else would like to share a program update? You can feel free to unmute if so.
Yes, good afternoon all. It's George Pate. Yes, I just want to remind everyone, National Night Out is August 4th. It's always the first Tuesday in August. And there's a flyer in the chat. And this is the 7th precinct will take place at the Shirley Chisholm Recreation Center, which is over there on Foster Avenue between New York and Nostrand Avenue. If anyone is interested in tabling, we still have space available. So I put my phone number in the chat. If anyone would be interested in tabling, they could either call the number on the flyer or they could call me, and I'll take care of it. Thank you.
Thank you, George. Hi, Suzette. Would you like to share?
Yes. Give me 1 second.
Okay.
Good afternoon, everyone. I hope the weather is not treating you too bad. Anyway, Hope and Healing Family Center, we're having a carnival of world flavors. Meaning, if you know of anyone that is interested in having us taste their cuisine, okay, they can register to come out and and help us introduce them to the community, and also any organization that would love to be part of their resources also to share in the community. They can register. What I did do is put my link. So what I will do is send you guys the flyer before I leave today, so you can share it with everyone and anyone else that would like to be part of. For the vendors that would like to share their cuisine, there is a fee. So everything is on the link. When they go in, and they will see the contract, that everything is in there. Okay, so I'll be sending it. Do I send it to Miss Cindy, or do I send it to you, Miss Lamaka?
You can send it to Cindy.
Oh, okay.
Mm-hmm.
All right. So I'll send it for her, and hopefully we get and share anyone that knows, other communities that want to, please, they're welcome to share and to participate.
Thank you.
Thank you.
Anyone else have a program update? Okay, I think we're all set. Just a reminder, if you have not completed the attendance form, please do that. We greatly appreciate it. Okay.
Excuse me, where's the attendance form? Is it in the chat?
Yes, it's in the chat. Yep. So we're gonna wind things up for today. Just a reminder, we are on social media, Facebook and Instagram. Our handle is East Flatbush Partnership. And this is our catchment area, 11203, 210, 212, and 226. And of course, if you have families that are not in these zip codes, we can still connect them with resources. Okay, so we are officially done, but I wanted to just leave the line open for a few. If there's any people that need to connect, feel free. You can connect in the chat, you can connect verbally. I'm going to stop recording, and we appreciate you for being with us during this time today. You guys have a great day, and I'll leave the Zoom open for just a few minutes. Okay, but we are done officially.
Take
Bye,
care,
everyone. Thank you.